Hi and welcome back. Today we're going to tackle COVID. Don't worry, we're going to get it all settled in 3 to 5 minutes. Never fear. The disclaimer I want to give you before we really delve into this is let's have a policy of less rage, more love. Disease doesn't have a political affiliation, and the information that I'm going to give you is the best information that we have that's evidence-based. Why do we still care about COVID? It's been 4 years of nonstop information. Well, thankfully, it's not as deadly as it was 4 years ago. But over that time frame, we have racked up 7 million hospitalizations and nearly 1.2 million deaths in this country alone. It still can be a significant cause of hospitalizations, days off work, and lost revenue. So we still need to know what we're dealing with so we'll know how to approach it. COVID can present with a multitude of different symptoms. It can be cold symptoms. It's an upper respiratory infection, so it's a brand of cold. It can start with sore throat, cough, congestion. Sometimes it's a bad headache or severe fatigue. Sometimes people will have shortness of breath or alterations in their heart rate. Sometimes nausea, vomiting, diarrhea. It can be just about anything. So if there is a great deal of COVID going on in your area at the time, it's always good to get tested. So if you test positive for COVID, what are the next steps? If you are at greater risk of severe infection, hospitalization, or death from COVID, meaning if you have underlying conditions like cancer, if you have a suppressed immune system, if you are diabetic or have underlying lung diseases, to name a few things, then there are antiviral medicines that can significantly decrease those risks. Paxlovid is the one that is most often prescribed, and it has the best results with keeping you out of the hospital, as high as 78% decrease in risk. Molnupiravir is available if you cannot take Paxlovid for either drug allergies or drug interactions, and does not have the same effectiveness at keeping people out of the hospital, but can decrease severity of symptoms. Now, what about things like ivermectin or hydroxychloroquine? Well, there were studies done on those, especially in the early days, but what wound up happening was they didn't have any better results at keeping people out of the hospital than just doing nothing, which is why we didn't recommend taking them. Let's talk about masks. Thank goodness we don't have to wear them all the time like we used to. There was a lot of controversy about them, but the way that I look at masks is it is a way to protect other people from germs you may be shedding, and as a healthcare provider, I now wear them in a room anytime I'm with a sick person, because the way I look at it, any layer of protection between me and a germ is not a bad thing. If you're COVID positive, how long do you have to stay home? Current recommendation from the CDC is 5 days after the start of symptoms. And then if you are improving and no fever, you can go back as long as you wear a mask for the next 5 days. There are some vaccines that are available to help prevent catching COVID. The initial vaccines were mRNA based. Some people aren't comfortable taking those, so there is a Novavax that's available. It is not an mRNA vaccine. So, thank goodness COVID isn't as deadly as it used to be, but we still need to take it seriously. And if you're healthy, be thankful for that, but be kind to those around you too. Don't forget to like and subscribe, and stay tuned.